Welcome to Human Anatomy and Physiology. This field explores the human body structure, anatomy, and function physiology, revealing how cells, tissues, and organs work together. Understanding these concepts helps optimize health, fitness, and disease prevention. You'll learn how systems like circulation, digestion, and nerves operate, empowering you to make informed choices about wellness. Whether you're a student athlete or simply curious, this knowledge deepens your appreciation for the body's remarkable design. By studying anatomy and physiology, you gain practical insights into exercise, nutrition, and early warning signs of illness, fostering a proactive approach to lifelong well-being. Levels of structural organization in the human body. The human body demonstrates an exquisite hierarchy of organization that reveals how simple components progressively combine to form increasingly complex structures. This organizational framework begins at the most fundamental chemical level, where atoms such as carbon, hydrogen, and oxygen interact to form essential biological molecules, including water, carbohydrates, lipids, proteins, and nucleic acids. These molecular building blocks establish the foundation for all higher levels of organization. At the cellular level, these biomolecules assemble into the basic units of life: cells. Specialized cells like cardiomyocytes in the heart, neurons in the nervous system, and erythrocytes in blood each possess unique structures tailored to their specific functions. Groups of similar cells then organize into the tissue level, where four primary tissue types emerge: epithelial tissues that cover and protect surfaces, connective tissues that provide structural support, muscular tissues enabling movement, and nervous tissues facilitating rapid communication. These tissues combine in precise arrangements to form the organ level, where distinct structures like the brain, heart, lungs, and liver perform complex physiological processes. Organs then collaborate within the system level, forming the 11 major organ systems that regulate bodily functions. For instance, the cardiovascular system coordinates the heart and blood vessels to circulate nutrients, while the nervous system integrates information through the brain, spinal cord, and peripheral nerves. Ultimately, all these systems integrate seamlessly at the organismal level to create a fully functional human being. This hierarchical organization illustrates the profound interdependence of bodily structures, where proper function at each level is essential for maintaining overall health and homeostasis. Understanding these relationships provides critical insights into human biology and the basis for medical science. Comprehensive Guide to Anatomical Directional Terminology. Anatomical directional terms form the universal language of spatial orientation in human anatomy, providing precise descriptors for locating structures within the body. These terms create a standardized framework that eliminates ambiguity in medical communication, research documentation, and clinical practice. Vertical orientation terms. The superior-inferior axis establishes fundamental vertical relationships. Superior denotes structures closer to head cranial, while inferior indicates positions nearer to the feet caudal. For instance, in the thoracic cavity, the heart maintains a superior position relative to the diaphragm, while the liver sits inferior to the lungs. These relationships remain consistent regardless of body position, whether standing, sitting, or lying down. Frontal plane designations. The anterior-posterior ventral dorsal axis describes front-to-back relationships. Anterior refers to the frontal aspect, as seen in the sternum's position relative to the heart. Posterior indicates dorsal positioning, exemplified by the vertebral column's location behind the abdominal organs. These terms prove particularly valuable when comparing organ positions or describing surgical approaches. Medial-lateral relationships. Medial structures approach the body's sagittal midline, while lateral elements diverge outward. The ulna demonstrates medial positioning in the forearm compared to the radius. These terms become crucial when describing limb anatomy or neurological pathways that follow specific laterality patterns. Proximal-distal continuum. Used primarily for appendicular structures, proximal indicates proximity to limb attachment points, while distal denotes remoteness. In the lower extremity, the femur is proximal to the tibia, which in turn is proximal to the talus. This terminology is indispensable in orthopedic assessments and vascular studies. Depth gradients. The superficial deep spectrum describes tissue layers, with superficial indicating external positioning, like the epidermis, and deep representing internal structures, such as a dermis beneath. This distinction is vital for injection techniques, surgical planning, and radiological interpretations. Clinical applications. These terms gain practical significance when interpreting imaging studies. The mass is posterior to the bladder. Documenting physical findings, tenderness in the proximal medial forearm. Planning surgical approaches, deep to the sternocleidomastoid muscle. Describing anatomical variations. The artery runs lateral to its typical position. Mastery of this terminology enables precise communication across all medical specialties, from radiology to physical therapy, ensuring accurate transmission of anatomical information regardless of the clinical context. The consistent application of these terms forms a foundation for all advanced anatomical study and medical practice. Anatomical body planes, essential frameworks for medical study and practice. The human body is systematically divided by 3 primary anatomical planes that serve as critical reference points for medical imaging, surgical procedures, and anatomical study. These imaginary flat surfaces allow for standardized visualization and description of internal structures from different perspectives. Sagittal plane. The vertical sagittal plane runs front to back, dividing the body into left and right portions. The mid-sagittal median plane creates equal halves, while parasagittal planes produce unequal sections. This plane is particularly valuable for assessing bilateral symmetry in structures like the brain's hemispheres or evaluating spinal alignment in orthopedic examinations. Frontal coronal plane. Perpendicular to the sagittal plane, the frontal plane vertically separates the body into anterior, front, and posterior, back sections. Radiologists frequently use coronal views in CT and MRI scans to examine organ relationships, such as the heart's position relative to lungs or the brain's frontal lobe organization. Transverse axial plane. The horizontal transverse plane divides the body into superior upper and inferior lower cross sections. This plane provides a characteristic slice views in CT scans and is indispensable for assessing internal organ morphology, tumor localization, and vascular pathways. Clinical significance in medical imaging. Modern diagnostic imaging relies heavily on these standardized planes. MRI and CT scanners capture images in all 3 planes for comprehensive analysis. Ultrasound technicians adjust probe angles to visualize specific planar sections. Surgeons reference these planes when planning operative approaches. Physical therapists use planar concepts to design rehabilitation exercises. Understanding body planes enables precise communication in radiology reports, surgical documentation, and anatomical research. Their consistent application across medical specialties ensures accurate interpretation of structural relationships and pathological findings, forming the foundation for effective diagnosis and treatment planning. Introduction to the integumentary system. The integumentary system is the body's protective outer shield, composed of the skin, hair, nails, and associated glands. As the largest organ system, the skin alone covers about 1.5 to 2 square meters and accounts for 15% of body weight. Key components. 1. Skin, cutaneous membrane. 2. Hair and hair follicles. 3. Nails, keratinized plates. 4. Exocrine glands, sweat, sebaceous, and ceruminous glands. Layers of the skin. Epidermis, the outermost keratinized stratified squamous epithelium, providing waterproofing and barrier functions. Dermis, the thick connective tissue layer housing blood vessels, nerves, and appendages. Hypodermis, subcutaneous layer of fat-storing connective tissue that insulates and anchors skin to underlying structures. Essential functions. Protection, shield against pathogens, UV radiation, and physical trauma. Sensation, contains sensory receptors for touch, pain, and temperature. Thermoregulation, sweat glands cool the body, while blood flow adjustments conserve heat. Synthesis of vitamin D. UV exposure triggers vitamin D production for calcium metabolism. Excretion releases water, salts, and waste through sweat. Immune defense. Langerhans cells in the epidermis detect foreign invaders. The integumentary system is vital for homeostasis, acting as the first line of defense while maintaining fluid balance and temperature. Its multilayered structure and diverse functions make it essential for survival. Introduction to the muscular system. The muscular system is the body's engine for movement, stability, and heat production, composed of specialized tissues that contract to generate force. Key components. 1. Skeletal muscles voluntary, striated muscles attached to bones via tendons. 2. Smooth muscles, involuntary, non-striated muscles and organs, e.g. intestines, blood vessels. 3. Cardiac muscle, involuntary, striated muscle found only in the heart. Primary functions. Movement, enables locomotion, walking, running, and fine motor skills, writing, speaking. Posture and stability, maintains body alignment and joint support. Heat production, generates warmth through muscle contraction, shivering. Circulation and digestion, smooth muscles propel blood vasoconstriction and food peristalsis. Protection, cushions internal organs and supports skeletal structure. 3 muscle types. 1. Skeletal muscle, fast, powerful contractions under conscious control, e.g. biceps, quadriceps. 2. Smooth muscle, slow, sustained contractions for involuntary processes, e.g. bladder control. 3. Cardiac muscle, self-stimulating contractions for continuous heartbeat. The muscular system works with the skeletal and nervous systems to coordinate motion, maintain homeostasis, and support vital bodily functions. The amazing machine, your body. Your body is an extraordinary biological machine, perfectly designed for survival, adaptation, and thriving. Every system, from the beating heart to the thinking brain, works in harmony to maintain optimal health and vitality. Understanding how your body functions is a foundation of lifelong wellness, empowering you to make informed choices about nutrition, exercise, and disease prevention. Continuous learning deepens your appreciation for this complex system. Whether exploring how muscles contract, how neurons communicate, or how cells regenerate, each discovery reveals the body's incredible precision and resilience. Further study unlocks even greater insights. Delving into genetics, biochemistry, or advanced physiology can enhance your ability to boost performance, slow aging, and prevent illness. By embracing curiosity about your body, you gain the ultimate tool, the power to nurture and protect your health for years to come. Keep learning. Your amazing machine deserves it. 150 words, motivational and engaging.